Thank you to everyone who has joined to hear a little bit more about the mind and skin axis and what we're doing in this study where we're exploring the links between eczema, sleep disruption, and mental health. Now, there may well be quite a few people who have eczema themselves who have joined the call. It affects 20% of all children in the UK, about 10% of adults. And it's true, it doesn't kill anyone. But if you have it, especially as severely as this patient of mine, it is a horrendous disease to have. You can see the inflammatory process here across the skin in various parts, the back of the feet, the scratch marks, the yellow crusting, which comes from the infection that's introduced by the intense scratching that's part of eczema. Itch is a hallmark feature. And then that thickening of the skin that patients get as well. We call that lichenification in medical terms. It's a natural response of human skin to get thickened up to protect itself from that regular impact of the scratching from the patient's hands and fingers. Skin infections are not just bacterial, but often viral as well. So this is the same patient. Unfortunately, she had a history of recurrent herpes simplex virus infection. So cold sores, quite severely sore around the mouth, as you can see here, but also in other parts of her body. So typical clusters, they tend to be quite painful to begin with. They then dry up and disappear over the course of 10 to 14 days. So the skin of patients with eczema or atopic dermatitis or atopic eczema are the medical terms that we tend to use, is less well protected against the outside world when it comes to infections generally. Eczema patients also have a higher risk of viral infections, viral warts, molluscum contagiosum, for instance. So she then flared in the face as well. Again, you can see that crusting around the eyes. And all of this was having a massive toll on her quality of life. She was bullied at school. She started to socially withdraw. She started to neglect herself. She refused to wash or have a bath. And there were very high anxiety and depression scores. It's a very typical case of someone I see in my pediatric severe eczema clinic. And as I've been seeing these patients over many years, I've wondered whether it is that sleep disruption that's driven by the itching that is one of the main links to the anxiety, the depression, and the ADHD and autism spectrum disease that we tend to see in these patients when they are a bit older. This video was shared with me by parents of one of my patients who were absolutely distraught seeing their child scratching in their sleep every night like this. And you can imagine if you never sleep, very often since being a baby, because 70% of eczema cases start under the age of 2, then that's a form of torture and must have a profound impact on how our bodies function. And that's what we're exploring in Mind and Skin. So atopic dermatitis or eczema comes about through a combination of genetic factors. The key mutation is a mutation in a gene called filaggrin. And essentially what happens is that if you have a mutation in the filaggrin gene, and imagine your skin barrier is like a wall with bricks and mortar, you have less mortar between your bricks. So you're losing more water from birth. Essentially, you have a predisposition to dry skin, and then in interaction with environmental triggers such as air pollution, but also water hardness. So domestic water calcium carbonate content, if that is higher, and you have a gene mutation in the filaggrin gene, my team has shown that you've got a 2.5 times higher risk of developing eczema in early life. Now, once you've got the inflammation there in the skin, people will start scratching. Babies, even if they're not able to purposefully scratch their skin, they still can show rubbing behavior. So, this happens very early on in life. And we wonder whether it's that sleep disturbance that somehow links in with neurocognitive function impairment. So essentially what we're looking at in Mind and Skin is, are there altered large-scale brain network connectivity issues that may be linking eczema with these neuropsychiatric conditions that we've observed in clinical practice. And this is quite a complex slide. I will talk you through it step by step. So in the periphery, So on the skin surface, in people with eczema, well, you have an increase in certain inflammatory cytokines, so chemicals. IL stands for interleukin, so they're chemicals that are secreted by inflammatory cells in the skin. IL-4, IL-13 are, if you like, the beating heart of eczema inflammation, and IL-31 is an important chemical that's also secreted by inflammatory skin cells that mediates itching. Now that will contribute to an impairment of the skin barrier, which may already be impaired because people have that gene in the filaggrin, a gene mutation in the filaggrin gene, and that will then lead to organismal stress in the broader sense, cellular stress in the periphery. Now, centrally, we know that these chemicals spill over into the blood circulation as well from the skin. So you can measure them as inflammatory mediators in blood. And that links in with the sleep disruption, of course, because of the chronic itching. So people have reduced sleep time, reduced sleep efficiency, reduced rapid eye movement sleep, the most important part, if you like, of our sleep as humans. And then resulting cognitive impairments, or reduced sustained attention, working memory, executive function, and processing speeds, leading to psychological stress. Well, and that will lead to further scratch behavior, which amplifies the peripheral situation here. And we know that people with eczema show central brain activity linked to restlessness. There's hypersensitivity, and that happens because you've got the nerves, obviously connection from the brain through the spinal cord going all the way into the periphery. You've got the sensory nerves there hyper-proliferating. So it's a bit like a tree with branches, and these branches are developing more and more and more branches in people with eczema, explaining their lower threshold of experiencing itching, but also pain. It's a common story that teenagers and adults tell us, that if they walk on the street or they cycle and there's a breeze hitting their skin, they experience that as uncomfortable, often as painful, compared to someone who doesn't have eczema. They won't really feel that very much. And this bit is quite fascinating because the skin and the nervous system embryologically come from the same tissue, the ectoderm. And as a baby develops in utero, their skin cells migrate from the central back, where the spinal cord forms, then the central nervous system, the brain. These cells migrate along lines, as shown here. They're called Blaschkoid lines, described by a German dermatologist under that name. The cells migrate in lines across all the way, coming round to the center, and that's where they meet. So a very close link between brain development, nervous system development, and skin development in utero already. And there's a close association between atopic dermatitis or eczema and developmental delay. This is in epidemiological studies, ADHD and eczema, language delay, behavioral problems in children, autistic spectrum disease, and eczema patients also showing cognitive dysfunction as adults. And in most of these conditions, ADHD, ASD, even without eczema, people have shown that there's an increase in transepidermal water loss. And that's a measure of how intact your skin barrier is. And it's actually something we measure in the Mind and Skin project as well. So even without eczema, in these conditions, an impaired skin barrier, again, linking the brain, the nervous system, and the skin. And this is, of course, all very, very complicated. And when I started thinking about, well, how we can take this forward, it became very clear that as a simple pediatric dermatologist, this is not something I can tackle alone, of course. So I put a multidisciplinary team of experts together, including colleagues from sleep medicine. So we're lucky to have Europe's largest pediatric sleep medicine department, just down the corridor from where my department is. We brought in a circadian rhythm expert from Surrey University. We have pediatric imaging science experts, colleagues from the Center for the Developing Brain. We work with colleagues at the Institute of Psychiatry, Psychology and Neuroscience. They're based at Denmark Hill, King's College Hospital, but they're part of King's College London. We have immunopsychiatry represented and experimental psychology as well. And we also brought in a dermatology colleague from Copenhagen who specializes in itching. So a really nice team to look at this very complicated relationship between eczema, sleep disturbance, and potential systemic and brain inflammation. I'm hoping that this will
Come with me
show.
and test
Just have a
eczema
listen.
affecting my
This
sleep.
is from one of our
When we got
patients
there,
in
I met the
Mind and Skin.
researchers. They showed me how the MRI would feel and sound like. They asked me questions about my health and they checked my weight. Then I had to complete some different puzzles and tests. For one, I had to recreate the shape shown on the paper with blocks. There was another where I had to click when I saw a spaceship on the screen, but not when there was a planet. The researchers measured my reaction speed. I had my sleep monitoring headband that I'll be wearing when I'm asleep to track my sleep levels, and it's also connected to an app on my phone. They tested the pH level on my skin to see if people with eczema had a higher pH level than people without. Then they connected me to a bunch of wires which I would be sleeping in for the first night. I felt like a robot. For the rest of the 10 days, I just wore the headband. And for the next 10 nights, I had to log when I woke up and when I went to sleep.
So I hope that has given you a bit of an idea of what it's like to be part of our study. You feel like a robot, but it's very exciting, I think, for those children in particular interested in science. So just to give you an even more detailed overview of what we're doing. So we've got 3 groups in the study. One group are the most severely affected by eczema. They have to receive what we call systemic immunomodulatory therapy. In fact, we are looking at 2 medications and their impact. With regard to all the different readouts, we're looking at in Mind and Skin, methotrexate and dupilumab. Methotrexate is a conventional immunomodulatory medication, and dupilumab is a biologic. Then we have group 2. So they are patients who have milder disease. They're just being treated with emollients and topical anti-inflammatory creams. And then the healthy controls, of course, because it's so important to see what is normal with regard to all of these different readouts. So from a skin assessment point of view, if eczema is present, we have a severity score called EASY. We measure that transepidermal water loss, as I said, as a measure of skin barrier impairment. We measure the skin surface pH because, as our participant explained so well, if the skin pH goes up, that has a detrimental effect on skin barrier function. We do a detailed immune profiling. We use tape stripping, which is a standardized way of putting cellulotape, if you like, a circular cellulotape on the skin several times. Each time we do that, we lift part of the superficial skin up, and not only the skin cells, but also the inflammatory markers that are active in the skin. And then we take blood for systemic inflammatory biomarkers. A lot of sleep recording, of course, because that's a really important aspect of Mind and Skin. We use polysomnography. That's the robot being fully connected. That's just for 24 hours. So 1 night's sleep. And then we use that dream headband that you saw in the video as well. Not quite as detailed, but gives us a lot of information, including EEG measurement. MFit is a mattress that senses people's movement while asleep. And then actigraphy, a bit like a Fitbit, sort of Apple iWatch, they sense movement. So scratch behavior can be measured that way. And then, of course, we've got the MRI scans, and we're doing various functional testing with our participants, and then the cognitive testing that you saw in the film as well. These batteries and the tests have been developed by Katja Rubia, who is one of the collaborators. She's professor of cognitive neuroscience at the IOPPN, and has a particular interest in ADHD as well. For those who are starting systemic therapy, they don't only have these investigations at the start, but also 4 to 6 months into therapy to see how their sleep how their brain function and brain activity might change as hopefully their disease improves, their itching is reduced, and their sleep improved as well. And I'm not expecting you to pick up everything that's on this slide, but just to show you a little bit of the detailed readouts that we are getting. So this is from the polysomnography. So for instance, we can look at the sleep profiles in detail. We can look at rapid eye movement, activities during the night. We measure, oxygen saturation and many other things. And the Dream Headband, for instance, gives us EEG output as well. This is from the MFit mattress. So it's very detailed monitoring of how people move and lie in bed. And then the actigraphy watches, which will be able to tell us whether someone's scratching in a purposeful way, as you can see here, very rapid movements up and down, or whether they are in a non-scratch phase. And this slide brings it all together. You can see the blood tests again there. That tape stripping, that little standardized tape, very useful in children. We can get readouts about the cytokines, for instance, that I showed you, interleukin 4, 13, and interleukin 31 that way. And we don't have to take skin biopsy, something obviously that wouldn't go down very well with pediatric patients, as well as that trans-epidermal water loss device there. And wanted to show you the functional MRI images because they are really exciting. You can see there sort of 3D mock-ups here. The active brain centers are marked up in red and yellow, and we can compare atopic dermatitis patients with healthy controls. And although this is early days, because we are only halfway through recruitment into the study, we have already shown that not only have eczema patients poorer sleep quality, we knew that already, but have confirmed it objectively with a polysomnography and the Dream Headband. But they also have an altered resting state in terms of cognitive activity and motor and somatosensory networks. They spend a longer duration scratching per night, have greater average movement frequency per scratch episode, and that is positively correlated with anterior insular connectivity with the right dorsolateral prefrontal cortex. What does that do? Well, it looks after executive functions such as temporal processing, working memory, and the modulation of negative emotions. So that's very much linking in with what we had expected to see in eczema patients. Because this is also complicated, our colleague Ulrich Bartsch from Surrey University, who is also our circadian rhythm expert, he's got a particular interest in machine learning and AI. He and our bioinformaticians are guiding us on bringing all these different layers of data sets, the sleep, the brain imaging, what we will be seeing from the skin immune profiles, the systemic inflammatory profiles, and so on, together into one analytical data set. And of course, the big question at the end is, could there be an early window of opportunity in eczema, as so many children develop it under 2 years of age? And the same applies to other intensely itchy skin conditions. So urticaria comes to mind there, for instance. It could be, if we intervene early, prevent the psychological and psychiatric sequelae that we see, including through the use of neurofeedback to target identified key neuronal networks involved. So in other words, using, for instance, relaxation techniques that target particular parts of the brain that are involved in the sensation of the itching and everything else that follows. Could we target them in a way that is very novel, holistic, complementary to the treatments that we usually use as dermatologists, the creams, anti-inflammatory creams, emollients, and of course those systemic medications that we're also testing in Mind and Skin. And lastly, if you're listening and you might have someone who is in the age of the Mind and Skin participants, so that's age 12 to 18, if they have eczema, they're very welcome to get in touch. We're particularly still looking for people who are starting systemic therapy, so are in the more severe disease bracket, as well as healthy volunteers. We pay everyone £100 vouchers for the inconvenience of taking part, as well as travel expenses. So if you want to contact the research team, you've got our email address down here, a QR code that takes you straight to the JOT form to express your interest, and you can also find out more information about the study on our departmental website. With that, thank you very much for listening. I'm very happy to take any questions. Rebecca, yes, now we can use it. Yeah, we can hear you.
Thank you, Carsten. That was fascinating. And as we saw from the video, such an emotive topic. The videos and the imaging that you showed were really emotive, and show why this is needed. So we do have some questions for you already, but to the audience, there are no silly questions. If you, we have access to Carsten as an expert here, so if you have any questions, please do put them in the Q&A, and we'll try and get to them. But to start us off, I was wondering, how do you control for that first night asleep when the children are hooked up to the robots, as we heard, when that could disturb sleep in itself? How do you find the difference between the sleep disturbance because of that and the sleep disturbance because of the eczema?
Yeah, I think so. One way of controlling for this, of course, is that the healthy volunteers will also have to go through this. So that, and so we are assuming that everything that we are finding that's different, distinctly different from what we see in the healthy controls to the eczema patients is eczema driven. We're working very closely with our sleep medicine team, and so what we are the way we're giving instructions and the way we're hooking the patients up is as slick as is possible, so reduce that effect, as you're saying. But it's it's important, obviously, to be aware of that. But the good thing is, and this is, so the sleep measurements that we're using are unique on several fronts. As far as we know, also through our sleep medicine team, nobody's ever done this in a home environment, and they are really impressed by, without praising my team too much, but they're really, as in our sleep medicine team, who are very much used to, and our experts in doing sleep studies, are very impressed by the quality that we're getting back. And then we have uniquely the Dream headband that we are also using, and we can use it as a way of validating as well. And of course, as the children are wearing that Dream headband over the course of 10 days afterwards, anything that may be introduced by that just one-off experience of the first night, and all of that being rather uncomfortable and so on. So I think we have a way of distinguishing if there's something that would be appearing as a signal from the polysomnography during the first night. We should be able to pick that up through the Dream headband measurements as well.
Right, thank you. Okay, so is there a link between bacteria on our skin and emotional well-being and mental health, even for those of us without eczema?
That's a very interesting question. Of course, people are very used to now to hear about work from the gut-brain axis, that the gut bacteria influence our human bodies in so many ways, our immune systems, but also have a direct impact on our mental health. And it's really surprising that it's only recently that the British Journal of Dermatology has published work from a UK group where they have purposefully taken skin samples from different parts of the body, the head and neck area, the arms under the axillae, genital area, the feet, and so on, and have been able to link up certain bacterial strains, Cutibacterium is the name of those strains, with improved mental health, especially if that Cutibacterium lives on the chest and the head and neck area. That obviously needs to be replicated to see whether these are robust findings, but also the hope is that we could potentially influence our mental health by introducing certain they're all non-pathogenic bacteria onto the skin.
Yeah, well, we look forward to finding out about those supplements and so on in the future, or potential medicines. So someone has asked, is there a comparable project for adults that can be accessed?
Yeah, that's a very good question. I don't think so. And I think this is pretty unique. As you could see from my slide about that multidisciplinary team, we were extremely lucky to have all of these people together in the same place. And because it's so complicated, hooking patients up just for the sleep devices alone, yeah, I'm not sure whether it would be easily replicated anywhere else. We have to do this at St. Thomas's, and our adult team is actually at Guy's. And so we have been, thinking about maybe doing something similar with adults as well at some stage. But it's just that logistic complexity of this study itself that made us decide that at least for this study we will focus on teenagers. So yeah, apologies if there is someone who would be keen to take part but is outside of the age bracket for the study.
Yeah. Well, we've had quite a few questions about adults actually, so I think if you ever were to go down that route, you'd certainly have an audience. You'd certainly have them.
But I'm happy to be answering any adult related questions if there are any that are there, Rebecca.
Sure. Okay, so just going to the other questions. Have you observed differences between the older and younger children within the study?
Yeah, very good question. So, I mean, children's brains develop obviously very quickly throughout childhood and even teenage years. And this is a big discussion point about what should be the age bracket for the study. So if we were to become too young, then these patients would have difficulty with some of the tasks we're giving them. If they'd be too old, then they have adult brains, and the brain structure, which is obviously something that we're looking at in Mind and Skin as well. Not just the function, but also the structure of the brain would also, would also change. What we haven't done at this point in time, but will do, is to, if we have the numbers, to compare the very young children in the study, let's say the 12 and 13 and 14-year-olds with those who are 17 and 18. But that we haven't really looked at that in any detail at this point in time.
Okay. And where do you see the treatment options going for the breaking of the neuronal feedback in the infants? So are there drug therapies, other methods that you think is the direction of travel?
Yeah, I think so. So one of the things that we will be hopefully able to look at in Mind and Skin are the systemic medications, that before and during or after systemic therapy comparison, to see whether these treatments themselves alter the brain connectivity and function in a way that it goes towards normalization. I would hope so. I mean, that would be phenomenal. And dupilumab in particular is a biologic, as I mentioned, so it shoots into the bullseye of eczema inflammation, switches off IL-4 and IL-13. It's not immunosuppressive. And it can be very effective and has turned around and literally transformed the lives of many of my patients, including the girl that I showed you at the beginning. So that's one possibility, that just the treatments we already have, especially advanced therapies, so the biologics that are coming through a very exciting pipeline of trials into NHS clinical practice, they may already have their beneficial effect. The other possibility is, could be meditation techniques that and in the broader sense. And one could test that even in a scanner. You could give someone relaxation techniques and put them through the scanner and see whether that reduces some of the negative connectivity you see in the brain of someone with eczema. That's another possibility.
Great, thank you. Okay, another question from the audience. You mentioned a link between atopic dermatitis and ADHD. Do you know what the increase in prevalence is for ADHD with atopic dermatitis compared to the general population?
Yeah, that is although it's a very important question, it's not so easily answered because the diagnosis of ADHD is not necessarily standardized in the studies that have been done. Various different studies, different methodologies, different diagnostic criteria, and the more population-based a study is, very often the less precise the diagnostic criteria that were used in the study. By population-based, I mean going into the general population. These data sets are usually huge. They have thousands of participants, but the data was usually collected using questionnaires, where patients or parents would have filled out questionnaires that give you a trait, if you like, for ADHD, but not necessarily a very firm diagnostic label. But we're talking about 20 to 30% of our eczema patients having ADHD and or autistic spectrum disorder, and the numbers are going up. But there again, is that partly because people are becoming increasingly aware of those links, and if studies were done 10 years ago when there was less awareness about these conditions in the general public, you will probably get different risk estimates compared to if you were going to do the study now. But there's definitely a very close link. What is not 100% clear is that chicken and egg situation. Is it definitely always that eczema comes first and then children develop autism or ADHD, or is it the other way around? I think both are certainly possible, but it's striking how many patients of mine, certainly when they come to our severe eczema clinic, have at least one of these conditions.
Yeah, thank you. We have from one participant who wanted to thank you for all of the information and for your team's work, and says, my son actually participated in the study and thought it was fun. I did, however, wonder about how his other allergic conditions could contribute to the results that you collect. He also has food allergies, allergic rhinitis, and EOE, which I'm not sure what it is, but I'm sure
that's eosinophilic esophagitis. So that's quite a rare but often severe allergic gut condition. So where children then end up having a very restricted diet. So it's please go ahead.
And
Rebecca,
just the end of it is, as do many other people with eczema. So how are you controlling for that? How is it contributing to the results?
Yeah, absolutely. So we do collect information on these conditions. We purposefully exclude patients who have any condition that is known to impact their sleep. Mm-hmm. So if they have severe hay fever and severe asthma, and they regularly have asthma attacks, and that could obviously have an impact on their sleep, we would not recruit them into the mind and skin study. We therefore hope that the people we have in mind and skin, where we are particularly looking at the link between sleep disturbance, that itching from the skin, and the brain activity and potential brain inflammation, that the other conditions will not influence the situation too much. But that doesn't mean that people with food allergy or eosinophilic esophagitis, so chronic substantial gut inflammation, may also have systemic inflammation and brain inflammation for that reason. Here the emphasis really is on itching from eczema, the sleep loss, and then the brain function.
Great, thank you. We've had kind of a few general questions about for people who, and I realise that without seeing people, you personally can't answer this specifically, but if people have eczema and poor mental health, where can they go on a practical level? So are GPs aware? Are they making use of this research? I realise it's very new research, but is it in the kind of general medical practice?
Yeah, and unfortunately in the NHS, having access to clinical psychologist is very difficult. I'm very lucky that I have a clinical psychologist, a pediatric clinical psychologist who specializes in skin and eczema in particular in my pediatric severe eczema clinic, but I think she's the only one like that in the whole country. So there is a huge need for mental health support for people with eczema. Some adult clinics will have clinical psychology support, but it's unusual to have the psychologist actually embedded in the clinic, which is where they are really needed, because they need to work as closely together with the clinicians as possible. Whether primary care physicians are aware of the links, I'm not so sure. In terms of resources, the National Eczema Society has good patient information, and they have a helpline as well for families with younger children. Eczema Outreach Support is our other national charity for families with children with eczema, and they have a helpline too, and they run webinars and have social media and other networks to help and support people. So they complement each other quite well, the National Eczema Society as well as eczema outreach support. But it's a big gap, it's a big need there, and for physicians who are not necessarily dermatologists but see people with eczema, to really understand those links will be beneficial for the patients, of course.
Yeah. Okay, thank you, and thank you for those resources. I'm sure people can go and look those up. So that's all we have time for today. So a huge thank you to you, Carsten, for joining us today. Thank you to those of you in the audience who've joined online to hear about this life-changing research. If you'd like to learn more about our work and how to support us, please visit our website. Carsten's research and this session, as well as all of the research funded by the Foundation, is only possible because of generous donations from members of the public, including many of you who are tuning in today. So if you enjoyed the presentation today and wish to make your own contribution to funding life-changing research, please consider making a donation to the Foundation. Thank you all for your support. We will email a recording of this session over the next few days so you can share it, watch it back, be reminded of those resources and so on. And we'd be grateful for any feedback at that stage too. I really hope you have enjoyed this seminar. Thanks very much, Carsten, and thank you all for listening.
Thank you.